I think a lot of patients come when they come to see me, they are suffering from significant pain and loss of function of either their hip or knee, and they're looking for solutions for the problem so that they can get back to activities that they enjoy doing. And oftentimes, they come to my office and they've had other non-surgical treatment options first, such as physical therapy, medications, injections, sometimes bracing. And they have questions about what a joint replacement might entail and what might that offer them in terms of a durable solution to their hip or knee pain. There's a great role for joint replacement in improving quality of life and function for these patients, and I love making that positive impact by doing that every day. It's extremely gratifying watching patients recover well from a condition that has been bothering them for years and affecting activities of daily living and simple activities that they enjoy doing. It's very gratifying watching them transform after surgery, after physical therapy, and watching them improve and get back to these activities.